supporting this, these two here, they are trying to destroy our local hospital. They are trying to destroy local people's health. And I don't know why that is, and I'd like an answer. Is it because they're naive and they think what Mark's just said, oh, we have to cut £1 billion or David Cameron will be cross with us? Are they just colluding with the government? Or are they Tories themselves? I don't know which it is. Whichever it is, we must do everything we can to resist. And that's why we are getting more and more people in the NHS Patients campaign and in other campaigns locally, fighting very hard against this across Ealing, Hammersmith and Brent, where we see our services being destroyed, ripened up for privatisation, and where Mark himself is yet to answer the question I've asked him 5 times. If this is a consultation, why before it started were you on BBC News declaring that 4 accident and emergencies were to close? That's not a consultation, that's you doing the Tories' dirty work.
Okay, several things there.
I'm not a Tory. I'm not doing the Tories' dirty work. The Tories have tried hard to stop me doing this because this suggests there are problems with finances in the NHS under the Tory party. They don't want us to have a discussion. We started this this discussion 3 years ago under the Labour government. We've been continuing it because we're trying to improve patient care. And that's been the driving force. The fact is that at the moment, if you go into your local A&E at Central Middlesex, there are no surgeons on site, there are no orthopaedic surgeons on site, no paediatrics on site, no obstetrics on site.
Yes, because you've taken on this.
I haven't done any of those things, so I wasn't involved in those things. That means you have an unsupported A&E, which gives much less good care than what we're recommending. What we're recommending is that every A&E should have a full range of emergency services to support it. There aren't the workforce to do that on 9 hospitals. That's just a fact. When you look at the numbers...
It's about money though, isn't it?
No, it's about the people. We can't employ that many consultants, not because of shortage of money, because they don't exist.
Because we don't train them.
That's part of the problem. When you do train them, they don't want to work in London, and the training posts are being moved outside London. But that means when we looked at the figures, we realised we could only sustain accident emergency departments and surgeons on 5 sites, which is why, when we looked at the figures, we were saying we thought we needed to close more A&Es. That's why we've come to consultation asking about that. I can't help what's always said on television when they're highly edited, we say, but that's why we're consulting on this.
So you did say that 4 A&Es are to close
I said
before the consultation started.
I said our figures suggested that's what we needed to do.
Yes, I'm very sorry, Mr. Darrow, that you went into my surgery to start interviewing some of my patients. No, there was papers in my surgery.
The patients took it in.
No, but you upset my patients. They came in to see me inside my consulting room. I'm upset as a doctor.
Because you are destroying the service.
No, I'm not. Can I speak?
You are destroying, don't get cross with me. I represent patients, you are attacking them.
No, I'm not attacking them. So if you have your time, let me speak.
Yes, well don't attack me.
No, I'm not attacking you. There were papers of NHS Brent campaign papers all over my surgery in my consulting room.
The patients took it
in the reception. But I had a patient participation group meeting of my practice 2 weeks ago, consulting my patients at my patients participation group regarding shaping a healthier future. So we do have our policies and how we do things in my practice. So that's my practice assigned, because that was brought in as a practice. So as a local GP in Brent of over 25 years, I do care about, whether you believe or not, the care of my patients. So like Mark mentioned, A&E at Central Middlesex has not been a full major A&E for years now. So we have been having not a full major A&E for years, and because of that, it has been deemed unsafe because we do not have people applying to do the jobs at Central Middlesex. So my question is, do we want a A&E which is not safe? So that's why A&E is in the environment that it is in now. So what we are talking today about is a safer NHS for all of us. So I just want us to take the politics out and just look at what we can do for the care of our population here.
Okay, can we come on to another question which you brought up, which is what's the level of support amongst GPs and French
The level of support, again, I'm glad to tell you, all the practitioners have signed up to the Constitution section of the CCG which is supporting this. You can give me the GPs who are saying they're not
No,
supporting.
they're too frightened. Do you know, GPs in this borough are too frightened to speak out because of what you and other managers will do to them if they speak out against these plans. That's what they're telling me.
Mark, do you want to say about you?
That's true, that's what
GPs are individual contractors to the NHS. They are in fact private and have been private since the start of the NHS, and subcontracts to the NHS. But GPs aren't scared of managers. I know very well as a GP that we have much more power than the managers have, and there's very little the manager can do to affect us. So I don't believe GPs are scared of managers in the slightest.
Okay. Going over to T-shirt, had his hand up earlier.
Yeah, you didn't respond to the question about consultation. How is it consultation when the options you offer us do not include saying no to the closure of A&E in Central Middlesex? You have a predetermined outcome. That is not consultation. I don't understand the thing about let's keep politics out of it. This is about politics. You say that some of the problems stem from PFI, a political issue. The whole thing around the future of the NHS is political. If your patients choose to discuss it in the reception, well, so be it. They ought, they have that right to discuss it. But you say, the other point is you keep saying, well, a proper A&E is fully staffed with surgeons, etc., etc., etc. Fine. Why isn't that what you're campaigning for, rather than campaigning for its closure? If the doctors aren't being trained and we have 16% unemployment in Brent, why isn't it that you're not campaigning to get rid of tuition fees, for instance, so people could actually enter that training and to become doctors, and campaigning for those things? What you're doing is simply saying, we accept all those things, we accept not enough doctors, we accept no proper facilities in the A&E in Central Middlesex, we'll close it down. That is not looking after the patients, that's not caring for the people of the area, which has big health problems, which has massive social problems. Saying they can all go to Northern Park does not address those issues.
So, I mean, a lot of those things are things that are well outside of the remit of what I can do. Training the doctors to become a surgeon who can work at Central Middlesex. Something will take 15 years. I'm afraid a long time before that, the safety would deteriorate a lot more than it has done. Those things are outside our control. I agree they're political things. And what my particular political campaigns are, especially like on politicians, as you do, is outside of this. What I'm looking at is the quality of care patients get. If you talk to the Royal College of Surgeons, they say that because of specialism in surgery, you need a team of about 10 surgeons to provide good care. That would allow the surgeon to work on site, doing emergency work, being consultant delivered care for 16 hours a day, 7 days a week. We know when you do that, people get much better outcomes. At the moment, if you go to Central Middlesex, there isn't an emergency surgeon there. I can train them. If they go there, they won't have enough activity because it's got a small area, but they won't be able to maintain their skills. So the reason Central Middlesex has suffered is because the training doctors were moved out of Central Middlesex because they weren't seeing enough work. That wasn't anything to do with us. The deanery, the people who designed doctor training, said they weren't seeing enough activity at Central Middlesex. It wasn't going to train them well, so they moved the junior doctors out. When you move the junior doctors out, it means the teams of doctors are too small, they're fatter, and that's why A&E was closed overnight, because there weren't enough staff to manage it, because of those problems.
Okay, I've got 4 hands. Lady at the back first, then the lady there, and the gentleman here.
Yes, I know you're going to just say the same thing as you've just said in relation to this, but I have to say that when you talk about the fact that, there isn't enough, there isn't work, we're going to, the work isn't there, so we're going to close it, it does strike me as a bit Alice in Wonderland. When I worked for a long time on the railways, and in the lead up to privatisation, what they started to do was to cut down on the services, to cut out trains, to cut, especially in some of the smaller stations, all sorts of things they started to do. And then they said, look, there's no demand for them. Well, what a surprise, because people couldn't use them on a regular basis. It's a bit like buses as well. And that's what happens, and that's what's been happening here. So what you've done is to accept the situation, and now people don't agree with Patterson, with the railways, and they wish they hadn't been privatised. And I think people are going to go along maybe they don't understand, and you say these things, well, you haven't got good outcomes in Central Middlesex. People's response may well be, well, we want better outcomes. But that's not the point. The point is whether you now say, we've let this go too far, we do need much more in this area, we need to build it up. And you're right in a way, you do need to have some progression, I agree, for medical staff, I understand that. But you've stopped that, and therefore it becomes a completely vicious circle. But it's the cuts and your approach that has caused this, not the other way around. And that's why I say it's very much Alice in Wonderland.
We'll take the lady here first, then we'll...
Okay, like the last speaker, I worked for Transport for London for 23 years in the travel information department. And in these documents about how much longer journeys will take, it's deeply flawed. Now, I was told that, oh, we consulted Transport for London. Well, they have a little program, computer program that plans journeys. I took the bother to listen for an hour yesterday on this machine about how to do journeys. After 23 years, I basically know journeys off by heart. Everything worked on the premise that no trains or buses or anything was cut. It was an ideal scenario. The figures are outrageous. We all know we don't live in an ideal world. We all know that there are strikes. We know that there are roadworks. We know there is traffic. But this doesn't seem to worry you in your document. You just sort of say, it'll take 10 minutes more. No, it won't. It'll take much more. Another thing is, and this was brought up by Graham from the NHS Patients Campaign, about how much it'll cost if people take a taxi. Okay, it'll take, Graham's written £8.40, I'd say more like £10, and at night, £20. All very well for a doctor, all very well for a well-paid person, not so good for a single mother with 3 children. Where's she going to find the money to get a taxi in the middle of the night? She isn't. What is she supposed to do? She's got 3 crying children, and she's supposed to take 2 night buses, and then on both her routes something is being cut out. This is really, I said to somebody outside, this is either Alice in Wonderland, Alice in Blunderland, or Malice in Blunderland. I think that this whole thing is anti-patients, is anti-local people. It is a study in cynicism. And I'm horrified that you can sit here looking so self-righteous when ordinary people, people like me, people like the people who are sitting here now, are going to suffer. You're not going to suffer. The well-off are not going to suffer. They can afford change.
Okay,
we can't.
Let's Mark respond.
The first of the questions around cuts. When there are cuts in the NHS, our spending year on year is increasing at a very small fraction. The other parts of government spend are being, no, there are no cuts. What we have to do is redesign how we spend our money. You can look at the figures. We will be spending more on the NHS at the end of this than we do at the beginning. What we have to do, though, is every time a new drug comes along, which I would need to treat a cancer patient, some of those cost £20,000 a patient, 3 years of treatment. That £20,000 has to be found within the budget I already have. That means I have to redesign what I spend elsewhere. That's the same as any of us do in our housekeeping. If we have an expense, we have to cut other things. That's not an overall cut. I agree with you. I wish there were more funding in the NHS. No major political party is suggesting more money in the NHS. I think with the financial situation we've got, I'm expecting this will get worse, not better. That doesn't mean this was driven financially. This is designed to have bigger teams of doctors working on fewer sites because that will give better care. That does mean that some people have to travel further. What we're trying to design is a local hospital at Central Middlesex which will continue to be the vast majority of services locally. And that means you won't have increased travel time because most people will still go to Central Middlesex for local.
Okay, and the travel one, so in terms of this disproportionate hits people on lower incomes.
So I'm just saying, most people continue to have care in their local hospital because the urgent care centre will manage most people. People who are ill enough to be admitted to hospital rarely go to hospital by public transport in the middle of the night. They tend to be using an ambulance. And most people, when you can look at the figures, because we've looked at this, people who are getting to hospital needing admission, most people have gone by car. And very common, if they don't have a car, and that's common in an area like this, they found a relative or a neighbour who could take them by car.
I'm not aware of all people in Harlesden having cars.
Now, as I said,
Very low car use.
22%.
22%, as you pointed the other night. But if,
That means 1 in 4 out of 5 people don't have a car to get to Northwick Park. Therefore, it's going to cost them £9 to visit their relatives. It's going to take them over an hour.
which is
How can Dr. Comm justify that for people on Church End where car ownership is the lowest in Brent?
which is why I said most people, if they're ill and need admitting to hospital, will be going by ambulance or ask a neighbour to drive them. So what happens? It does have an impact on
Well, 4 out of 5 of their neighbours haven't got cars either.
They tend to know which ones have. But there is absolutely an impact on people who are going to visit relatives. At the moment, because we've centralised stroke care and heart attack, people are admitted to hospitals further away, and relatives do have to travel further and recognise that. And relatives visiting is important, which is why we're planning in local hospitals a rehabilitation bed, so they may be admitted to Northwick Park for a stroke. They can have their rehabilitation closer to home, so that people can see it more easily.
Okay, gentleman in front of me.
My name is Robin Sharp. I'm not part of any campaign, but I have been trying to spend a lot of time in the last 2 months going into this on behalf of this church, which I belong to, Queen's Park Residents, which is also address these issues. And I've got some wider concerns I'd like to raise, but as we've talked a lot about central Middlesex, I'd like to come in on that. I mean, what seems very